So this illustration shows some of the most common site for administration of drugs through subcutaneous injection. So if you notice, no, it's not only in the abdominal area, you can also have on the back, on the buttocks, and on both arms. Then take note, if you saw the picture, the degree of angle that is used is 90 degrees. Now why? I have mentioned a while ago that the angle of administration of subcutaneous injection depends on the needle. So if you are using a gauge 26 needle or 27, sa needle kasi the higher the gauge, the smaller the needle is. So gauge 26, 27 is used in administration of insulin, whereas gauge 21, 22, 23 is used in intramuscular administration. So if you are using the smaller needle, so you need not to put that in an angle of 45 degrees in order to reach the subcutaneous tissue. You can give that 90 degrees. Okay? Kasi maiksi lang siya. But if you're using those needle that is also used for intramuscular injection, then you put your angle on 45 degrees. Next is administration of injectable medications through intradermal route. Intradermal. So that means we have to introduce the medication in the dermis, no? The dermal layer of the skin, the outermost layer of the skin. So this route of administration is used for skin testing. Saan ba natin ginagamit yung skin testing? So before we administer antibiotics to the patient, we usually do the skin testing. No? And the main reason there is you have to determine if the patient has developed certain allergy to the medication that we're going to administer. It is also used for giving BCG. No? Yun yung BCG or the Bacillus calmette-guerin immunization given to the newborn. Ang tawag natin dun ay bakuna, BCG. So they are used to, we are also using intradermal for that particular drugs, no, or immunization. Take note also that intradermal administration has slow absorption and skin testing is required. We usually use 1 cc syringe, no, for intradermal, or the new one is called tuberculin syringe. Ang angle of insertion in administering intradermal injection is usually 5 to 15 degrees, no, with bevel up. Bevel is the part of the needle wherein the sharp, no, the sharp part of the needle. That is the bevel. So in intradermal injection, our main objective there is to create a small bleed. No? Ang bleed parang kanyan no? Kumbaga parang gagawa tayo ng pantal. No? Kung nakakita kayo ng pantal, so pag nakagawa kayo niyan during intradermal injection, then that's it. No? Perfect ka na doon pag meron ganyan. So ang administration of intradermal injection usually allows us to check after 30 minutes if the patient develops an allergy to the drugs or not. So if the patient develops allergy, then we can request to the doctor to change the medication. So this particular presentation shows the different angle of insertion for different types of injection. So if you're giving intramuscularly, no, from the left, you consider that the angle is straight 90 degrees. So if you're giving that subcutaneously, the angle is 45 degrees. But again, as what I have said, take note if you are using large or small needle. But if you are using small needle subcutaneously, you can also use 90-degree angle. And on the last part, it's intradermal. That means you are administering the drug just in the dermal layer of the skin. So 15-degree angle. This presentation shows the different types of syringes. So if you need a larger volume of the medication to administer to your patient, then you use 5 cc syringe. You have 3 cc syringe. On letter C, that is 1 cc syringe. And on letter D, that is what you call insulin syringe. So there are also bigger types of needle, more than 5 cc capacity. You have your 10 cc capacity, and you can also have your 50 cc syringe. This presentation shows the different parts of the syringe. No? So you have your plunger, the barrel, the tip, the, and the tip there is that is the area where we're going to put the needle. Then we have the measure dose and avoid touching this area of the plunger, no? Because that is the area that should always comes in contact with the medication. So this is the part of the needle. So you have there the bevel, the shaft, and the hub. So different types of needle. I mentioned a while ago that the higher the number of the needle, the lower or the smaller it is. Now, so I will start with the bigger one. This is gauge number 18. Gauge number 18. So going down, it's 21. The third one is 21 also. The fourth one is gauge 23. And the last one on the lowest part is gauge 26. So these are example of medications that are usually administered parenterally. So parenteral, that includes your injection, either intramuscular, intradermal, or subcutaneous administration. So on letter A, you have there the medication preparation and ampule. So these are medications prepared in an ampule. And on letter B, medication prepared in vial form. So if medication administration needs two medication at the same time, you have to use your knowledge now whether those medications are compatible to mix in one syringe. Although there are medications that are usually combined, and these are compatible, but you have to take note also that there are medications that are incompatible with each other. For example, syringe or mixing insulin in one syringe. Compatible yan kasi ang insulin, mayroon siyang rapid acting at saka intermediate acting and slow acting insulin. So we usually administer this, or the patient independently administer this, because they are compatible to be combined in just one syringe. So mixing medications from a vial and an ampule, you have to prepare medication from the vial, or you have to mix the medication from the two vials, provided that both medications are compatible. So in administering the drug, as medication nurse, we have a collaborative role with the pharmacist, no? Because most of the hospital, pharmacists are the one who prepares and distribute this medication. Kasi they have the so-called AMDS, or Automatic Medication Dispensing System. No? But not all hospitals have this so-called system. And in that case, nurses will be the one to prepare the drugs after the patient was able to provide it. Our role there is we need to assess the patient's ability if they can do that self-administer, because there are drugs that can be administered by the patient or by themselves alone. It's like oral drugs, no? Or giving insulin. No? We have to teach the patient, because by the time that they will be discharged, they're the one to administer insulin for themselves. Although you have to determine whether your patient can receive or administer it correctly, monitor the effects, and as much as possible, if the patient has some experiences or negative experiences relative to taking the drug, then do not delegate this particular task. So one of the mortal sin commonly committed by nurses is medication error. So if you heard some of these errors committed by the nurse while administering the drugs, so as much as possible, there is no room for error in administration of medication. So that's why you have to always remember these 10 R's, no, or 10 rights in administering medication. So always remember the right patient. So in choosing the patient, you have to use two identifiers, no, that is located on the patient's chart. You can use, you have to compare the name with the ID or the MAR. MAR is the medication administration record. So all patients in the hospitals have the so-called MAR, or medication administration record. You have also to remember the second R, the right drug. No. So after you have the drug, you read the order, to match that if the order is the same with that on the MAR. The right dose, so how many milligram? 100, 200, 1 gram. Right route, ano ba, how are you going to administer that? Oral, intravenous, okay. Right time, so right time is not specifically standard, no? It depends on the institutional policy. Just like for example, if drug is once a day, so other hospital usually give that 6 a.m. There are other hospitals give that 8 a.m. So it depends on the policy of institution. Right documentation, so take note that once you give the drug, you have to document that on the patient's chart. Right to refuse. So if the patient does not want his medication to take, or sabi niya hindi ako makainom ng gamot ko kasi wala akong pambili, then it's the right to refuse for this certain medication. But we have policy for that now. They have to sign a form signifying that they refuse that certain medications. This is for legal purposes naman. So, kasi whatever happens to the patient, you will be held liable for that. So, although nakagustuhan nila yan, so just to play safe, you let them sign the form. So, kanya-kanya ng policy ang hospital dyan when it comes to refusal of treatment. Right assessment, make sure that you assess the patient before giving the medication. Kasi baka mamaya ay magaling na yung pasyente or the medication is not anymore needed by the patient. So just like medication for fever. So, bakit magbibigay ka pa? Wala naman lagnat ang pasyente. Okay? Right education, make sure that you have given the right information or necessary knowledge for the patient. If the patient asks you, nurse, why am I taking this medication? So give the right health teaching because it is the right of the patient to be educated. Right evaluation, you usually after giving the drug, you evaluate the effect. Go to your patient, ask them, how are they doing now? Kamusta na po kayo? Kamusta pong pakiramdam pagkainom niyo po ng gamot? Okay? So, you have to evaluate and you need to document that. And so, these are our nurses' role, no? As far as medication is concerned. So, for number one, always follow the 10 rights before administering the drugs, no? Or before and after administering the drugs. Then you also have to read the label so 3 times, so 2 to 3 times compared to the medication administration record. Then use at least 2 patient identifiers and mention that. Avoid interruption. So we are speaking here of the continued administration of medication based on the timing. So if the patient will be taking the drug 3 times a day, so dapat ay 3 times a day. Huwag mong i-interrupt. So double check calculations. No, usually medications given to the patient is calculated based on the doctor's order. Number 6, sometimes unusual doses is ordered by the doctor, so we need to question sometimes unusual doses that is given by the doctor. Kasi alam din naman natin yan. Sometimes kasi hindi mo kailangang maging sunod-sunuran lang sa doktor. You have to compute by your own. Record after medication is given. So, the response of the patient before, during, and after giving the drug. Errors should be reported and documented properly. So, in the hospital, they have their programs to reduce or how to reduce medication errors. You have to be active in participating in that programs in the hospital. Then, of course, education. Educate the patient about the medication. So, in case of medication error, as nurses, we need to report all of that errors in medication. And upon discovering that there is error in medication, our top priority is safety of the patient. So after securing the safety of the patient, document properly because documentation is considered and it is legally binded. It can be used against you, against the hospital, or against the patient. So that's why you have to proper documentation in the patient's record. The nurse is also responsible for writing an incidental report, so you make an accurate factual description what has happened before, during, and after a certain error. And of course, you have to make sure that you have to play an essential role in this medication reconciliation. So why does medication error happen? So these are some of the most common reasons. One, inaccurate prescribing. No, kaya I have mentioned a while ago that we also need to compute our own based on the doctor's order, because sometimes the doctor also commit an error that can lead to inaccurate prescribing, no? Especially when it comes to the dosage. Giving of wrong medication, so amoxicillin, ang nabigay natin ay ampicillin. Sounds like. Using the wrong route, giving at the wrong time, nagkamali ka ng tingin sa oras mo, ay late pala yung relo mo. Extra doses, okay? Imbis na 60 milligram, nagiging 600 milligram. Ang laki. Then, omission of scheduled doses, kasi sa sobrang dami ng pasyente, ay nakalimutan yung ibang dose. So, those are some of the commonly reason why we nurses commit error and medication. So how are we going to avoid? No? These are some of the suggestions for us in order to avoid some medication error. Checking of compatibility chart. That means the order must be compatible or compatible with what is written on the patient's chart. You have to check for some allergies to the patient. So because sometimes you're giving the drug without knowing that the patient is allergy. Then never the drug administered that is prepared by your colleagues in the area or other nurses prepare that, then you're going to administer. So as much as possible, you have to avoid that. Do not leave medications at patient's bedside. Okay? Then we have to check medication sheet with ID bond of the patient. This is sometimes ay nabibigay sa ibang pasyente yung gamot. So some drugs require two nurses to check and also check the expiration dates. This slides is about medication abbreviations, no? Kasi in the doctor's order, they usually use the so-called abbreviations, no? So these are the most commonly used abbreviations. No? I just want you to be familiar, no, with these abbreviations because later on during your hospital exposure, we can encounter this in the patient's chart. Now, I will not discuss this anymore and wala naman masyadong kailangang i-discuss dito. Our main objective here is you have to memorize what does this abbreviation means, no? So just like this RX treatment, no? BID twice a day or 2 times a day, SOS if needed, AC before meals or PC after meals. Now just be familiar and memorize this kasi you need this as you go along with our RLA exposure, no? Especially when you will expose in the hospital. Same with the slides, no? Just be familiar with the meaning. SQ, subcutaneous, ID, intradermal, Q4H every 4 hours. So don't mind the asterisk, no? Parang design lang yan. So asterisk is not included. So there are also orders of the doctor usually if the patient needs the so-called acute care emergencies. No? So these are the different types of the medication that is usually ordered, no, in acute care agencies. No? If that patient or if that order is standing or routine order, so as nurses, you need to administer that until the dosage is changed or until the medication is prescribed. You also have PRN given when the patient requires it. Just like for example, the doctor's order goes like this: mefenamic acid 500 milligram Q6 hours PRN. So that means pag may PRN sa dulo if the patient requires it or when necessary. Single or one-time order, this is given one time only for a specific reason. So give Moxiclub 1 gram now. Ayan na yun. Stat, that is immediately. No? So nitroglycerin sublingual stat. So that means you have to give that right away. Now, okay, now is different from stat. Now, when a medication is needed right away but not stat. Okay? So, pwede siyang ma-delayed pero pag may stat, hindi mo pwedeng i-delay. Prescriptions, these are prescribed drugs, no, that usually taken by the patient when the patient is discharged, no, or at home. So these are some of the medication ordered by the doctor using some of those abbreviations. Now, I just want you to be familiar with these abbreviations. So, like say for number 1, Cephalexin 500 milligram capsule PID. So that means you have to give that medication 3 times a day. Ampicillin 1 gram Q6 hours PC ANST. So that means you give ampicillin 1 gram every 6 hours. PC is after meals and ANST is after negative skin test. So, meaning, bibigyan natin siya ng ampicillin every 6 hours and after meals and after negative skin test. So, mag-i-skin test muna tayo dyan using the intradermal route. Ascorbic acid 500 milligram OD, so that means you have to administer that medication once a day. Cefazolin 1 gram QID, HS, and ANST. So that means you give Cefazolin 1 gram after negative skin test, QID that is 4 times a day, and HS that is hours of sleep. So 4 times a day plus hours of sleep. So for this presentation, I give you an example of medication abbreviations based on the timing. So this was used in Quezon Medical Center. No? So in that particular hospital, you need say OD, you have to give the drug 8 a.m. So BID have the time, PID, QID, and Q6. No? So at this point, future nurses, I want to say thank you so much for listening to this audio presentation of mine. So I hope this will give you the needed knowledge, no, as far as administering drugs is concerned. And again, regarding your return demonstration, I will have to talk with the management on how we are going to do that. We cannot take it for granted that you will do this through video, because as I've mentioned, it's very delicate and a close supervision from our clinical instructor is needed. So at this point, I want you to say thank you again and hope to see you soon.